Congenital heart disease happens when there's an abnormality in the structure of the heart, and it's usually something that babies are born with. About 1% of all babies, or about 40,000 babies in the US per year, are affected with some form of congenital heart disease. This can be detected on a prenatal ultrasound or on newborn screening, which we'll talk about a little bit later. Treatment of congenital heart disease is with medication or surgery, depending on how severe and symptomatic the congenital heart disease is. Minor cases of congenital heart disease may require more so observation rather than medication or surgery as well. So, what are some of the signs and symptoms of congenital heart disease if it's not found? So, patients can present with poor growth and feeding, right? Cyanosis. So they might have a bluish tint to their skin. They might also have signs of heart failure, like rapid breathing, tachycardia, edema or swelling of their extremities, and hepatomegaly due to swelling of their liver. Some patients also present with a cardiac murmur, although this isn't always required for there to be congenital heart disease. And in some cases, patients are totally asymptomatic. They may not know, and you may not know as their parent or caregiver that they have congenital heart disease. This image is showing a diagram of the heart, and the heart consists of two sides. There's a right side of the heart shown here in blue, and then a left side of the heart here shown in red. The right side of the heart pumps deoxygenated blood from the right ventricle into the lungs. And then the left side of the heart takes that oxygenated blood from the lungs and pumps it out into the rest of the body. Congenital heart disease can result due to defects either in the valves that connect these different components or these different chambers of the heart, as well as the chambers of the heart themselves, if there's holes or if there's dilation or restriction of the size of some of these chambers. Those can all result in congenital heart disease. There's several risk factors for congenital heart disease. These include pregestational diabetes, where a mother has diabetes prior to pregnancy. And that's because high glucose levels, especially in the first trimester, are very teratogenic and can cause multiple congenital anomalies, not just cardiac disease. Smoking and alcohol use are also risk factors for congenital heart disease. Maternal infections like rubella can also result in congenital heart differences, as can lithium or isotretinoin, which are medications that are used to treat schizophrenia and acne. Genetic factors are at play in some causes of congenital heart disease, and it's important to note that about 50% of cases of congenital heart disease do not have an underlying identifiable cause, be that genetic or environmental. There are several genes associated with isolated congenital heart disease. These include transcription factors, cell adhesion molecules, and structural proteins. There are also syndromic genetic disorders associated with congenital heart disease, and some of those are listed here. They include trisomy 21, DiGeorge syndrome or 22q11.2 deletion syndrome, Turner syndrome, and Noonan syndrome, just to name a few examples. Congenital heart disease can also be subclassified into cyanotic versus acyanotic lesions. So cyanotic meaning that the patient is going to appear bluish due to low oxygen levels in their blood, and this is because the deoxygenated blood is mixing with the oxygenated blood within the heart due to that congenital heart defect. Many of these cyanotic lesions start with or contain the letter T. So you can see here truncus arteriosus, tetralogy of Fallot, transposition of the great vessels, just to name a few examples. And then contrast that with the acyanotic lesions that we see here. Typically, there's no mixing of the deoxygenated with the oxygenated blood that ends up entering the arterial circulation. And finally, newborn screening for congenital heart disease is something that's very important to be done, especially in the first few days of life. This is done with something called pulse oximetry, where we measure the oxygen levels in the baby's bloodstream. It's really important that we detect this early because of something known as the ductus arteriosus, right? And this is a conduit between the pulmonary artery and the aorta that is normally open in the fetal period, but that closes within the first few days of life. And for some causes of congenital heart disease, it's important that we maintain that PDA open before we can bridge that patient to surgery. And so, important to recognize a congenital heart defect if one is present so that we can preserve the PDA if necessary. If you found this video useful, please like, subscribe, and share. You can subscribe to my monthly newsletter with board-style questions, and you can also buy me a coffee to show your support for the channel. Thanks.